All right, we're going to go over one of the more common reasons for lower back pain. This is very evident when a patient tells you they're hurting on one side or the other, right? And that's going to be the Quadratus Lumborum, okay? It is not a Harry Potter spell, contrary to popular belief. It is a very small muscle, okay? Triangular shaped right here on both sides. Now, a good reason why QL pain is very, very common is because of improper form when picking up something. Okay, we have what's called muscle spindle fibers that run along the fibers that are naturally there, right? So these muscle spindle fibers will tell our muscles kind of what a normal range of motion is. So why do I bring that up? Because you'll notice if I go to pick something up, okay, and my lower back is rounded, those muscles are now at a fully stretched position. Okay, so those QLs will activate and kind of stop my body from going past that range of motion. Why is that bad? Well, the reason why that's bad is because if I'm bending over, picking something up, and those muscles start taking over, these tiny little muscles in the lower back, what will happen is they're the first ones that are recruited when I pick up something heavy. So not only are they supporting my upper torso, they're also having to support whatever I'm grabbing. So that's a large reason why these muscles get stretched, strained very, very easily. Okay? So, besides teaching people proper form, okay, we're going to go over how to address the immediate pain. Okay, so a lot of times those muscles will seize up on people, and it just be locked in. It'd be so hurt, but it's our muscles' way of, kind of protecting themselves. It's kind of our natural response. So, simple way. I usually will use this combo 1, maybe even 3 times, depending on how bad the patient's pain is. Okay, I must forewarn you. When you're doing this one, it does feel uncomfortable and a little bit painful, but the immediate relief that you feel afterwards is definitely well worth it. Okay, so we're going to start off with a lacrosse ball. Okay, I always use a lacrosse ball. It's nothing really bigger than that because those QLs are really small, and that's kind of what we want to aim at. So, say my left QL is hurting. So what I'm going to do is I'm going to go ahead and plant the opposite foot down, okay? So I've got that opposite foot planted. I'm going to take the ball and I'm going to put it right where that QL hurts the most, right? Okay, I can adjust my upper body by having my hand kind of crawl away from me, okay? I can put more pressure on it, okay, and I'm right on the spot, okay? So next step is I'm going to angle my foot up, okay? This part is really important because we want to also lift up the knee a little bit off the ground, but I don't want it to where my knee is up and my foot is down, okay? I want that foot up, knee is slightly off. I'm going to bring it up, and I'm going to come down. I'm going to call that 1 repetition. 2, 3, and I'll go all the way up to 10, okay? It'll feel very uncomfortable because that muscle's going to be seized up, but it's going to release as the patient goes through the rest of the motions. Okay, so the next step is to stretch it out. So what I'm going to do is I'm going to go ahead, I'm going to plant that opposite side. I'm going to go ahead and push on the hip on the knee that's down. Okay, so I'm pushing on that hip. I'm going to take that opposite arm, and I'm going to put my palm up towards the sky. Okay, as I put my palm up towards the sky, I'm going to stretch. I'm actually trying to push my elbow to the ceiling. Okay, so I'm trying to push that elbow up to the ceiling, and I'm going to push on this side of my hip. Breathe and relax. Hold it up to 20 seconds. Okay, breathing and relaxing is very important with stretching because you're trying to get that muscle to calm down and realize this is a safe range of motion for you. Okay? So again, palm up towards the sky, pushing that elbow up towards the ceiling. I'm going to push with this opposite hand. Get that stretch in. Coming forward slightly, just until they feel that stretch and that cue out. All right? Usually, my patients, after doing it one time, they'll get up and I'll have them, test out their back, and they're like amazed at how much relief they've already gotten. So, again, another good one to kind of give that immediate relief to patients, and we'll go from there.
Yeah.